Partant, what if the everyday habits you barely think about are quietly damaging your erectile function, and you do not even realize it is happening? I am talking about routines so common that when I ask my patients to stop, they look at me in disbelief. They assume these behaviors are harmless. Some even believe they are helpful. But the medical evidence tells a very different story. Research shows that men who ignore early signs of erectile dysfunction face a 14% chance of experiencing a heart attack within 7 years. 14%. That is not a small number. Your penis is often the first warning system for your entire cardiovascular network. It reacts before your heart does. It signals trouble before major arteries become critically blocked. In another study, researchers found that men who consistently use aggressive masturbation techniques, sometimes referred to as death grip syndrome, can permanently reduce penile sensitivity and trigger erectile dysfunction over time. These are not rare cases. These are patterns I see in clinic every week. Today, I am going to walk you through 10 things you should never do to your penis after the age of 50. Some of these will surprise you. Some may challenge habits you have had for decades. And the final mistake may be the most important of all. My name is Dr. Mika Hayashi, and I am a board-certified urologist. For more than 10 years, I have worked with men over 50 to protect their penile health, restore erectile function, and maintain sexual vitality well into later decades of life. Most of the damage I treat is preventable. That is the frustrating part. Men assume these behaviors are minor, but over time they erode blood flow, nerve sensitivity, hormone balance, and tissue integrity. Today, that cycle stops. Stay with me until the end because I am not only listing these 10 critical mistakes. I will explain exactly why each one is harmful, share real patient experiences that prove how serious the consequences can be, and outline the practical steps you can take immediately to reverse course and protect your function for years to come. Let's begin with mistake number 1, ignoring your penis. It sounds obvious, yet it is the most common error. Your erections are not just about sex, they are a health report card. The quality, firmness, and frequency of your erections reflect the state of your cardiovascular system, hormone levels, nervous system signaling, and metabolic health. A major study published in the American Journal of Cardiology followed men who developed erectile dysfunction. Within 7 years, 14% suffered a heart attack. Erectile dysfunction is often called the canary in the coal mine because the arteries in the penis are the smallest arteries in the body. They are even narrower than the coronary arteries that supply the heart. When plaque begins to form or circulation starts to decline, the penile arteries show symptoms first. I once treated a 59-year-old man who came to me complaining of weaker erections for about 6 months. He assumed it was simply aging. He felt embarrassed and waited before scheduling the appointment. When I ordered cardiovascular testing, we discovered significant arterial blockage. He was dangerously close to a major cardiac event. By identifying the problem through his erectile symptoms, we were able to intervene early. His circulation improved, and so did his erections. He later told me he almost ignored the issue entirely because he did not want to talk about it. That hesitation could have cost him his life. If you notice consistent changes in erectile firmness, duration, or frequency, do not dismiss it. See a urologist. See a cardiologist if necessary. That single decision may prevent something far more serious. Mistake number 2 is attempting do-it-yourself penis enlargement. Let me be direct. There is no safe, effective home remedy for increasing penile size without medical supervision. No cream, no internet device, no exercise technique is harmless just because it is marketed aggressively. One of the most dangerous trends is a practice known as gelching, where men apply repeated forceful stretching motions to the penis in hopes of increasing length. Studies and clinical experience show that this creates microtears in the erectile tissue. Over time, those small injuries form scar tissue. Scar tissue does not expand like healthy tissue. It reduces elasticity, and interferes with normal blood trapping, leading to curvature, pain, and erectile dysfunction. I have treated young men in their 20s who permanently damaged their erectile function because they believed online promises. The damage can be irreversible. Another risk involves homemade constriction devices. I have seen men arrive in emergency rooms with metal rings, bottlenecks, or hardware components stuck at the base of the penis, cutting off circulation. In one case, we had to involve emergency services to remove a metal object that had caused severe swelling and nerve compromise. The outcome was long-term sensitivity loss. If you choose to use a constriction ring, purchase a medical-grade device designed for safe removal. Do not experiment. The penis is not a laboratory project. Avoid applying unverified substances. I have treated chemical burns caused by vinegar, essential oils, and homemade topical mixtures. The skin is delicate and highly vascular. Irritation quickly becomes infection. Infection can lead to scarring. Respect the anatomy. Protect it from unnecessary trauma. Because the next mistake is just as common and just as preventable. Par deux, mistake number 3 is poor hygiene, and this problem exists at both extremes. Some men neglect basic cleaning, while others overdo it and damage the very tissue they are trying to protect. Balance is essential. If you are uncircumcised, daily care is not optional. You must gently retract the foreskin, clean underneath with mild, unscented soap and warm water, rinse thoroughly, dry completely, and return the foreskin to its normal position. When this routine is ignored, bacteria and moisture accumulate. That leads to balanitis, an inflammation of the foreskin and head of the penis that causes redness, swelling, pain, and discharge. Repeated infections can lead to phimosis, a condition where the foreskin becomes so tight that it cannot be pulled back at all. Once that happens, hygiene becomes even more difficult, and infections become more frequent. Beyond infection, there is a more serious concern. If you cannot retract the foreskin, you cannot properly inspect the glands for abnormalities. Penile cancer is rare, but when it does occur, early detection is critical. I have treated men who never realized something was wrong because they never examined themselves properly. By the time visible symptoms appeared externally, the disease had progressed further than it needed to. Many of those cases could have been managed more simply, if caught earlier. On the other hand, excessive cleaning can be equally harmful. The penile skin is thin and sensitive. Harsh antibacterial soaps, heavily scented body washes, or aggressive scrubbing strip away natural protective oils. That disruption leads to dryness, cracking, irritation, and increased vulnerability to infection. I treated a 62-year-old man who developed chronic redness and painful fissures because he believed using strong antibacterial soap daily would keep him healthier. In reality, it damaged his skin barrier. When he switched to a gentle cleanser and reduced friction, his symptoms resolved within 2 weeks. Clean daily, but clean gently. That is the standard. Mistake number 4 is ignoring pain or visible warning signs. If you see something unusual, feel persistent discomfort, notice discharge, sores, ulcers, lumps, blood in the urine, or swelling that does not resolve, do not wait. These symptoms can signal infections, kidney stones, bladder conditions, sexually transmitted infections, or in rare situations, cancer. Fear and embarrassment delay treatment more often than lack of access. I once treated a 57-year-old man who noticed a small ulcer but convinced himself it would heal on its own. He waited 6 months. When he finally came in, we performed a biopsy and confirmed early-stage penile cancer. Fortunately, it had not spread, and we were able to treat it with localized surgery that preserved most function. Had he waited longer, the surgery would have been far more extensive and life-altering. He later admitted that fear kept him silent. Your health is more important than temporary discomfort during a medical exam. If you ever feel dismissed or judged, find another physician, but do not avoid evaluation. Mistake number 5 involves unsafe sex and lack of control. Many men over 50 assume sexually transmitted infections are a younger person's problem. That assumption is incorrect. Infection rates among adults over 50 have risen significantly in the past decade. Reduced fear of pregnancy often leads to reduced condom use, but viruses and bacteria do not care about age. Herpes, gonorrhea, chlamydia, syphilis, and HIV remain real risks. Safe sex is non-negotiable. Use protection with new partners. Discuss testing openly. Get screened if you have multiple partners. As immune function declines with age, infections may take longer to clear, and complications may be more severe. Beyond infection risk, there is also the issue of penile fracture. This occurs when an erect penis bends forcefully, tearing the tunica albuginea, the outer fibrous layer that contains erectile tissue. It most commonly happens during vigorous intercourse, when the penis slips out and strikes the partner's pubic bone. The sound is unmistakable. Patients describe a popping sensation, followed by immediate pain and rapid swelling. The penis may become discolored and deformed within minutes. This is a surgical emergency. Repair should occur within 24 hours to preserve erectile function. Men who seek immediate treatment often recover fully. Those who delay face a much higher risk of permanent dysfunction. I have treated both scenarios. The difference in outcomes is dramatic. Prevention is straightforward. Maintain control during intercourse. Guide movement rather than relying solely on momentum. Use adequate lubrication. As natural lubrication may decrease with age, adding lubricant reduces friction and lowers the risk of sudden bending injuries. Lubricant improves comfort, enhances sensation, and adds a layer of safety. One 64-year-old patient came to the emergency department within 2 hours of injury. Surgery was performed promptly. 6 months later, his erectile function returned to normal. He acted quickly, and that speed preserved his sexual life. Now, let's move to mistake number 6. Which many men underestimate because it feels relaxing rather than harmful. Excessive heat exposure can quietly disrupt hormonal balance and reproductive health. Your testicles hang outside the body for a reason. They function best at a temperature several degrees lower than core body temperature. When that temperature rises for prolonged periods, sperm production declines and testosterone levels may drop. Frequent hot tub use, long sauna sessions, and extended steam room exposure can elevate scrotal temperature enough to interfere with normal function. Research shows reduced sperm count and motility in men who spend excessive time in high-heat environments. Even men who are not trying to conceive can experience hormonal changes that affect libido, energy, and erectile quality. Heat does not only come from water or steam. Laptops placed directly on the lap for long periods raise scrotal temperature. Keeping a phone in a front pocket exposes the area to continuous warmth. Tight underwear that presses the testicles against the body reduces airflow and increases heat retention. I treated a 56-year-old man whose testosterone had fallen to 280. He reported daily hot tub sessions lasting 30 to 40 minutes. After discontinuing the hot tub routine for 3 months, his testosterone rose significantly, and he reported noticeable improvement in energy and sexual desire. Moderation matters. Limit hot tub and sauna sessions to short intervals. Allow cooling periods. Use a desk or barrier under electronic devices. Choose breathable underwear that allows natural airflow. Because the next mistake does not involve temperature or infection, it involves something far more subtle but equally powerful, the way you stimulate yourself. And this is the point where most men make a critical mistake. They assume that if they can occasionally perform well, nothing is wrong. They think, it worked last week, so I'm fine. But performance that is inconsistent is not random. It is information. Your body is communicating with you. Erection quality is not just about desire. It is a complex coordination between your brain, your blood vessels, your hormones, and your nervous system. When everything is aligned, firmness feels effortless. When even one part is slightly off, sustainability begins to fade. Let's go deeper into what separates the man who stays firm all night from the one who loses momentum in minutes. First, blood flow efficiency. An erection is fundamentally a vascular event. When you are aroused, blood rushes into the penile chambers and is trapped there by compressed veins. If arterial inflow is strong and venous trapping is efficient, firmness is maintained. If inflow is weak or outflow leaks too quickly, firmness declines. Now, what affects blood flow? High blood pressure, elevated blood sugar, chronique inflammation, sedentary lifestyle, smoking, excessive alcohol, poor sleep. These factors slowly damage the inner lining of blood vessels, the endothelium. And the penile arteries are small, much smaller than the coronary arteries of the heart. This means erectile changes often appear before heart symptoms. So when firmness fades quickly, it may not just be a bedroom issue. It can be an early vascular warning sign. Second, nervous system balance. Many men underestimate the impact of stress. When you are anxious, distracted, or mentally pressured to perform, your sympathetic nervous system activates. This is the fight or flight response. It diverts blood away from non-essential systems, including sexual function. An erection requires parasympathetic dominance, the rest and relax state. If your mind is racing, if you are worried about duration, size, or pleasing your partner, you are physiologically working against yourself. Men who stay firm often have one hidden advantage. They are mentally present. They are not monitoring their performance every second. They are engaged in sensation rather than evaluation. Performance anxiety creates a loop. One short episode of fading leads to worry. Worry increases adrenaline. Adrenaline reduces blood flow. Reduced blood flow confirms the fear, and the cycle repeats. Breaking that loop is often more psychological than physical. Third, hormonal stability. Testosterone plays a role in libido, energy, and overall sexual resilience. But here is what many people misunderstand. Testosterone is not just about desire. It influences nitric oxide production, which directly affects blood vessel dilation. Low testosterone does not always mean complete dysfunction. Often it presents as reduced rigidity, slower arousal, or difficulty maintaining firmness. Factors that lower testosterone include chronic stress, poor sleep, obesity, and lack of resistance training. Men who stay firm consistently tend to have stronger metabolic health. They sleep deeply, they move their bodies, they maintain muscle mass. These habits stabilize hormones naturally. Fourth, metabolic flexibility. Insulin resistance is quietly one of the biggest contributors to erectile inconsistency. Elevated insulin and glucose levels damage nerves and blood vessels over time. Even before a diabetes diagnosis, subtle changes begin. You may still feel healthy, you may look fit, but internally, glucose spikes and crashes affect circulation and nerve signaling. This is why diet quality matters far beyond weight control. Excess processed carbohydrates, sugary beverages, and ultra-refined foods gradually reduce vascular elasticity. Men who perform consistently often have better glycemic control, even if they have never thought about it in those terms. Now, let's address something uncomfortable but important. Pornography overstimulation. When the brain is repeatedly exposed to high-intensity visual novelty, dopamine pathways adapt. Real-life stimulation may begin to feel less intense in comparison. This can manifest as delayed arousal or difficulty sustaining interest without constant novelty. This does not happen to everyone, but for some men, reducing excessive stimulation resets sensitivity and improves responsiveness in real interactions. Your brain is plastic. It adapts to what you feed it. And finally, physical conditioning. Pelvic floor strength is rarely discussed in men's health conversations. Yet those muscles play a direct role in maintaining rigidity by supporting venous occlusion, the trapping of blood inside the penile chambers. Weak pelvic muscles can contribute to faster loss of firmness. Strengthening them through targeted exercises can improve endurance and control. When you combine improved cardiovascular health, stress management, hormone support, metabolic balance, and muscular conditioning, you create a foundation for sustainable performance. This is why quick fixes often disappoint. A pill may temporarily increase blood flow, but if underlying inflammation, stress, or metabolic dysfunction remains, the effect may feel inconsistent. The difference between firm all night and fading in 2 minutes is rarely a single cause. It is usually a combination of small factors stacking together. The good news? Most of these factors are modifiable. Improving sleep from 5 hours to 7 can increase testosterone and lower cortisol. Walking 8,000 to 10,000 steps daily enhances endothelial function. Strength training 2 to 3 times per week boosts nitric oxide signaling. Reducing alcohol intake improves REM sleep and vascular response. Practicing mindful breathing lowers sympathetic overactivation. None of these changes are dramatic on their own, but together, they transform sexual resilience. And here is something equally important. Age is not the primary determinant. I have seen men in their 20s struggle with sustainability due to anxiety and poor lifestyle habits. I have seen men in their 50s maintain excellent function because they prioritize health consistently. Erectile performance is less about chronological age and more about biological age. So if you notice inconsistency, do not panic. But do not ignore it either. Ask yourself, how is my sleep? How is my stress level? How is mid-diet? How often do I move? How often do I feel truly relaxed? Because the bedroom reflects the body. In the next part, we will talk about specific, evidence-based strategies you can implement immediately to strengthen endurance naturally without relying solely on medication, and how to measure whether your improvements are working. Understanding the difference is the first step. Taking action is what changes the outcome.